Tracy?
Yes.
Hi, Tracy. My name
Hi.
is Roberto Callis.
Hi.
I'm a PA who's going to be doing your medical history and physical
Okay.
exam today.
Okay.
Before we get started, is your mom or dad here today?
Yeah, my mom brought me. She's in the waiting room. Does she need to come in or?
No,
Okay.
sure. I just wanted to make sure that maybe one of them was here in case we have any questions for them
she's here.
about insurance or stuff like
Okay.
that. So tell me a little bit about what brings you into the clinic today.
Well, I told my mom that my heart's been racing or just kind of racing, and so she was nervous and wanted me to come and get it checked out.
So can you tell me what you mean by racing?
I can just tell that it's just really beating fast, pretty much all the time.
Pretty much all the time.
Mm-hmm.
So, and how long has this been going on for?
Gosh, I think I first noticed it like a week or two ago, somewhere around there.
And do you remember, when you first noticed it for the first time, were you doing anything in particular?
Yeah, the first time I noticed it, I was riding my bike with a couple of my friends, and it was really fast then. But since then, it seems like it stays fast all the time.
And can you maybe describe it again about, like you say, you put your hand on your chest and you were saying beating fast. Is that literally what it feels like?
Yeah, it just feels like this under my skin, just like beating fast. One time I checked my pulse and it was over 100. So that was that's when I was just sitting there.
And have you ever had this thing before, this type of sensation before?
I have not. No, not before I noticed that on my bike.
Okay. And as far as you know, have you ever had any problems maybe with like your heart?
No, I've never had any problems. My mom says everything's been fine.
Okay. I know you said that you have it all the time, but have you noticed anything that maybe helps it go away or makes it better?
Yeah, the more like still and calm I am, I guess, the better, the slower it is. But it still seems, even when I'm trying to relax or like I'm laying down going to sleep, I still feel like it's faster than maybe it should be or than it has been before. So, but maybe if I'm just laying real still, it's a little bit calmer.
Okay. And what about, I think you already told me the answer to this question, but what about stuff that makes it really bad?
Yeah, just like I was running for a class I have in school. We were running the other day, and it was really beating. And then I've ridden my bike, I think 2 other times since then, and so the running and the riding my bike made it really fast. I've never checked it, but it's fast.
All right. I know you said that you never had any problems like with your heart, but what about any problems with like nervousness or anxiousness?
Yeah, I'm pretty nervous. Like, just I feel almost shaky or just.
Before this happened or since this has happened?
I've always been kind of a nervous worrier kind of person, but lately, like in the last couple of weeks, probably in the last month, I would say that's been longer than I've noticed the heart, that I just feel sometimes like shaky on the inside, just nervous or shaky on the inside.
And is this something that maybe you've had to see a counselor for at school?
No, but my mom's been talking to me saying that she's worried about that too. Actually, we talked about that before I told her about my heart, that she just says I seem like I'm on edge, she said. So she talked about having me talk to our counselor at church.
All right. And does anybody in your family, maybe mom or dad or anybody, kids, brothers or sisters, anybody else have something like this?
No, I think my mom said her sister did something like this. Just recently, actually, in the last couple of years, she had a thing where her heart was racing. I don't know what happened, but
so you don't know.
She said it reminded her of her sister.
So you don't know what the diagnosis was? Or
No.
And with this sensation, do you have any chest pain?
Not really pain, but just feels, I don't know, maybe like uncomfortable if I'm running when it's going really fast. It feels a little bit just uncomfortable. Just
so when you say uncomfortable,
pressure maybe?
A pressure, so
Pressure maybe?
not pain, but maybe a pressure?
Just maybe a pressure.
What about shortness of breath?
Yeah, when it gets to going really fast, I think I feel a little like I want to catch my breath.
Okay. And what about any fever or chills?
No, I've been fine.
No. Nausea or vomiting?
No.
A lightheaded or passing out?
No.
Okay. All right. And how has your weight been?
Wonder if my mom wanted somebody to say something about it. I've actually lost some weight, like 20 pounds.
20 pounds.
Uh-huh.
And were you trying to lose weight?
No.
No? And so 20 pounds, and like how long did it take you to lose the 20 pounds?
Gosh, like 3 months.
3 months?
Mm-hmm.
And so you're not trying to lose the weight. But how much are you eating?
Oh my goodness. My mom says our grocery bills like gone up in the last year. I eat a lot. I eat all the time. Like I try to eat healthy food, but it seems like every hour or two I eat what you would maybe say is a small meal. So I'm just constantly eating, I guess. She says I eat like a horse.
So nothing then like where you maybe sometimes throw up food that you've eaten?
No way.
No way. What problems with like diarrhea? Maybe.
No, I go to the bathroom like that, kind of go into the bathroom like once a day.
Once a day?
Mm-hmm.
Okay. All right. And what about with all this eating, are you able to do any exercise? Are you exercising?
Well, yeah, I mean, I usually ride my bike most every day, but it's making me a little bit nervous, so I've only done it a couple times because it is making me a little bit nervous about my heart beating that fast. But yeah, normally I'm really active. I usually like run with my friends a couple miles a day, or we'll go ride our bike, or so we try to do something most days.
And how are you doing in school?
I'm good. Good. My grades are good, yeah.
Are you involved in any clubs, organizations at school?
I am on student council. That's pretty much in school, and then I play tennis.
Switching gears a little bit, have you ever noticed that sometimes you feel really cold or feel really hot?
I definitely never feel cold. I think if anything, I'm always hot. Yeah, seems like I'm always hot. I could wear tank tops like in the winter.
All right. And I know I asked you about diarrhea, but what about going to the bathroom to urinate or pee a lot?
I think that's normal. I drink a lot of water, so not when I'm at school because we can't, but like when I'm at home, I drink a lot of water, so I go to the bathroom like maybe once an hour.
All right. I think I already asked you this question, but here it goes. Do you have any medical conditions or medicines that you take for a medical condition?
No, my mom has me take a vitamin. I've always taken like a multiple vitamin, but I don't know of anything.
Okay. So what about anything over the counter?
Oh, yeah. When I have my periods, I'll take like some Tylenol.
Okay.
Just
So
a couple times.
regarding your periods, are they regular?
They come pretty much every month, but they used to be maybe like 4 or 5 days, and the last 3 months they've been 2 days. So I didn't know if that was okay or not, but
All right.
that's a little bit different. That they're about half as long as they used to be.
Okay. And
Still every month though.
so when did you last have your menstrual cycle?
Let's see, it was 3 weeks ago.
3 weeks ago?
Mm-hmm.
Okay. And are you sexually active?
No way.
Okay. And do you have any allergies?
No.
No.
Mm-mm.
And do you smoke cigarettes?
No.
Do you use any drugs?
Never.
No. All right. And I think that's most of the questions I wanted to ask you. Do you have any questions for me, or is there something?
Are we
maybe
gonna have to do any tests or anything today? Or I'm a little bit nervous about like what we might have to do.
Blood test? Or?
Yeah, or just I don't know what you do for your heart, but I'm kind of nervous about what you
Well,
do.
probably go ahead and listen to your heart.
Okay.
And probably do things like check your lungs and feel your
Okay.
neck.
Okay.
Probably gonna have to draw some blood though today.
Okay.
All right.
Okay.
Do you want me to get one of your parents in?
No, I'm fine.
You're fine?
Yeah.
All right. Well, I think I'm going to step out for a few minutes,
Okay.
and I'll be back in about a minute.
Okay.
Thank you.
Great, thank you.